government on its improvement. So the question is the motion be agreed to. The Honourable Martin Aldridge.
Thank you, Mr. President. I start today by talking about this important issue, making some comments in relation to Part C of my motion. And obviously, this motion in private members' business, as is consistent with standing orders, won't come to a vote today, so it won't formally be referred to one of the parliamentary committees which this House is entitled to refer a matter to. However, I hope that I have couched a motion in terms that will receive support from across the spectrum of the House, as I think that this is an important issue, and I think it's an important enough issue that that the relevant parliamentary committee conduct an appropriate inquiry into how we can improve the access to healthcare, and in particularly specialist healthcare in regional Western Australia. The Patient Assisted Travel Scheme, or PATS, as it is commonly referred to, makes a significant contribution to people living in regional WA who from time to time are required to access specialist medical care that isn't found locally. In preparing for today's debate, I found it interesting, something that I didn't know was that this scheme some 30 years ago was actually a national scheme administered by the Commonwealth Government and funded by them. It was then called the Isolated Patients Travel and Accommodation Assistance Scheme, or IPTAS, and it provided assistance to those people living, or those people required to travel in excess of 200 kilometres for specialist medical treatment and oral surgery. In 1987, the responsibility for IPTAS transferred to the states and territories, and there was a direct funding provided from the Commonwealth to the states and territories through a special revenue assistance grants. In 1999, that direct funding assistance was abolished in favour of the states and territories agreeing to a revenue flow from the goods and services tax. Although funds are no longer specifically earmarked for PATS from the Commonwealth, this matter is addressed in the National Healthcare Agreement 2012 and subsequent agreements. And I'd like to quote from this document. It's a Council of Australian Governments National Healthcare Agreement 2012. Better Health Services is the heading of the section, and Clause 20 of the agreement under a subheading of Roles and Responsibilities says this: states and territories will provide health and emergency services through the public hospital system based on the following Medicare principles. And subsection of that clause C, arrangements are to be in place to ensure equitable access to such services for all eligible persons regardless of their geographic location. So I think that this is something that's really important to consider in the debate today around equity and access to specialist medical care across our state. It is important to note that since the state has been administering PATS since 1999, there has been some significant changes and improvements to the scheme, including in 2008 a boost to the PATS program of $30.8 million directly from royalties for regions has been committed over the last term of the Parliament. This has resulted directly in a 43% increase in the number of patient trips supported by PATS, 78% increase in the overall cost of PATS that has been met by government, and a 57% increase in the number of vehicle subsidised trips, with the greatest number of increases coming from the Midwest, Goldfields and Wheatbelt regions of our state. The WA Country Health Service in 2012 embarked on a fairly comprehensive community consultation program as part of the Southern Inland Health Initiative, and I was fortunate enough to attend some of those sessions. I think 3 of them I attended, and it was interesting to note from those forums that commonly the 2 major issues that were raised by the community and stakeholders from the medical fraternity were PATS, and second to PATS were volunteer transport. And talking to the WA Country Health professionals at these forums, they said that those 2 issues were common amongst all the other forums that they held across the Southern Inland Health area. It's widely acknowledged, I think, amongst the community and within the WA Country Health Service that PATS was a system designed for a different era in medical service delivery. There are 3 areas specifically that should be the focus of an inquiry into this matter. One would be the level of funding that is applied to the transport and accommodation subsidies that are provided, the inflexibility of eligibility measures in applying the PATS funding, including the application process, and the need to consider exceptional circumstances. In relation to the funding through the patient-assisted travel scheme, an applicant travelling by motor vehicle can claim a fuel subsidy of 16 cents per kilometre or commercial accommodation allowance of $60 per night or $75 per night if travelling with an approved escort. It's interesting to note that the Australian Tax Office each year hands down a determination in relation to reasonable running costs of motor vehicles, by which you can ordinarily claim a deduction if it's used for work purposes. And I note from the determination that's available on their website that those reasonable rates of deduction range from 63 cents per kilometre for the smallest motor vehicle through to 75 cents per kilometre for the largest of motor vehicles. And I think that's an important point to make in relation to, I guess, the imbalance that, that is occurring between what is reasonable in terms of recompensing somebody for, in particularly that motor vehicle subsidy. Commercial accommodation costs, I think something similar could be said about that in relation to $60 a night. Members in this place all know the cost of commercial accommodation in Perth, and I would suggest that even in the cheapest of accommodation places that you'd be lucky to reach 50% of the cost outlay. Another issue that's come to my attention is the awareness by both medical practitioners and patients in their ability and eligibility to actually claim PATS assistance. And I think over the years, as we've tried to improve PATS, inherently we've probably added to the complexity that's associated with claiming the assistance, as we now have different rules from location to location, from illness to illness. We're even finding now that medical practitioners are now charging a higher consultation fee so that they're able to process the PATS paperwork, and in some cases the return from PATS is not that much more significant than the fee that the medical practitioner is charging to actually complete the paperwork. So I think they're all areas that we probably need to have a look at. I talked a little bit earlier about exceptional circumstances, and I think that the primary eligibility criteria at the moment of the 100-kilometre minimum distance to specialist medical care is something that that needs to be reassessed. And I would like to talk specifically about a case in my electorate of Claire and Terry Priddle, who reside in Bindoon, just north of Perth. Claire and Terry are the primary carers of 3 children, all of which have autism, and 2 of which have the neurodegenerative disorder leukodystrophy. Managing the health needs of their 3 children is a full-time commitment from both of them. Accessing specialist medical care in Perth, often at Princess Margaret Hospital as well as through other specialist medical providers, is usually always a weekly affair, if not more frequent. The official main roads distance between Bindoon and Perth is 84 kilometres, some 16 kilometres short of meeting the eligibility criteria for PATS. On the surface of this, if you were suffering perhaps a minor ailment and you required a one or twice, a singular or perhaps a couple of trips to Perth to deal with a broken limb or to see a specialist for something that's not ongoing, I think most people are able to absorb the financial challenges of having to do that. However, I think there are cases like Claire and Terry Priddle which are exceptional, and I don't think anybody could argue that the medical needs of their family would be placing a financial burden on them by the fact that the medical services they require aren't available locally and they do have to travel to access those services. Some might ask why the Priddle family don't move closer to where they can get access to the specialist medical care that they need. And I think quite often probably families do make decisions around where they live based on the services that are provided. But in their case, they have some very good reasons. They have enormous local family support, which I think, given the circumstances of raising 3 children, all with different medical requirements, they really do rely heavily on the support of their family, and their family in the greater Chittering area who provide that support. One other thing that's available to them in that area is the community housing, so a partnership between the Shire of Chittering and the Department of Housing to provide the appropriate housing for their family. And I understand that within 12 months they're going to have a special built disabled housing available to them, because as the condition of their 2 daughters further degenerates, it's likely that both of them are going to be wheelchair bound in the near future. And the other thing that they've got locally is fantastic school support, and they are supported by the Disability Services Commission and their local area coordinator, and their advice to them is that given the level of support and understanding that's provided to them from their local school, there would be a real risk in actually relocating their family to another town or another location where perhaps they aren't going to be provided with that same level of support. I think this is a good example of where we perhaps aren't providing that equity in access to specialist medical care, and exceptional circumstances like this, I think, do need to be considered in the process in which we administer the PATS system. Another example is a constituent of mine from Narrogin who had their PATS claim rejected. They travelled to Perth to seek specialist medical treatment, put their claim in, and it was rejected on the grounds that that the specialist service that they were seeking was available in Bunbury, some 8 kilometres closer than Perth. Now, 8 kilometres in the context of a travelling distance of some 190 kilometres begs the question whether or not the system needs to be a little bit more flexible. The system fails to recognise that perhaps this patient would have been better supported in Perth, where they would have had a greater choice of medical specialists, where they perhaps would have had family or friends to support them in terms of their overnight commercial accommodation, perhaps where they could have linked other business and activities whilst they were visiting our capital city, and perhaps in that case they may have only been remunerated to the extent that they would have been able to access that service that 8 kilometres shorter. I'm not surprised if some of the criteria around PATS is aimed at actually reducing the number of applications, because obviously if we increase or broaden the criteria to PATS, there's obviously going to need to be funding attached to that. So I think that there is probably some reluctance to improve that access to, I think, to bring it in line with the National Healthcare Agreement, which is to provide equitable access to medical care across our state, because that will come at a significant cost, and I acknowledge that. I think in concluding my remarks in the time that I've got left today, I think that there are also a few other areas that we could probably look at, and that is the list of specialist medical services which aren't available for funding through PATS, and that includes speech pathologists, physiotherapists, podiatrists, clinical psychologists, occupational therapists, audiologists, pathologists, dentists, and nursing professionals. So there's a range of other services there which I think that in the context of a broad look at the PATS system should perhaps be taken into consideration as to whether some of those are areas of need, in particularly those around mental health. This was an issue that featured in my inaugural speech early this year, and it's one of the challenges that I hope to make some progress on in my time in this place. I'm sure regional members would agree with me that PATS requires review, and I think merely looking at the number of contacts that our electorate officers have just demonstrates, I guess, the need for having a better look at this system. I think that the work that the WA Country Health Service staff do is good, but I think that they're only constrained by their ability to deliver within the eligibility criteria of the system, and obviously the funding that we provide to it. Obviously there are some other areas in which rather than bringing people to the medical care, we can bring medical care to them, and I'm sure the Parliamentary Secretary in responding will talk about telehealth as well as visiting specialists and a few other areas in which we can perhaps try and prevent some of these long journeys to Perth. Thank you.
Yeah.